Hello everyone, my name is Marie Dalmis and welcome to my channel, A Wealth of Good Health. Today I am going to talk about major depressive disorder. What is it? How to diagnose it? And what can we do about it? Well, before we start to dive into the subject matter, please subscribe, alright? To watch more videos in English, French, and Creole. And if you, a family member or a friend, are struggling with this disease, go to my email and ask Marie. Well, let's talk about simple sadness versus depression. How do we know someone is depressed? Alright, let's talk. Usually, people struggle with occasional feeling of sadness or loneliness. They can be unhappy because of a specific event, such as loss of employment, loss of a loved one, changing in the season, birth of a baby, etc. They all can be normal. However, people with depression feel a constant sense of helplessness and despair nearly every single day for more than 2 weeks, which impact their previous functioning. Depression can be acute or chronic, mild or severe. Some people have it once, others have it several times in a lifetime. Depression can be caused by different factors. Biological factor can be one. Usually we refer to people as, oh, there's a family history, which means when you find someone with depression, most likely a family member may already have depression. A psychological factor. What does that look like? For instance, exposure to prolonged stress. That's one example for psychological factor. What about environmental factor or social-cultural factor? It's another type. DSM-5 is a manual that we use to diagnose mental health condition. Well, according to this big blue book, depression is marked by persistently depressed mood most of the day and a loss of interest, which we refer to as anhedonia, in normal activities and relationships. A person suffers from major depression must have 5 or more persistent symptoms that are present every single day for at least 2 weeks. This depressed mood must represent a significant impairment in daily life, including changes in affect and cognitive functioning. Let's talk about symptoms. Before we talk about the different symptoms, since we need 5, I am going to refer to a board which will help you with the mnemonic that I used, which called SIGI caps. So the SIGI cap we are going to use is on the board. S stands for sleep. Changes in sleep pattern such as insomnia or hypersomnia nearly every day, meaning you're having trouble falling asleep or staying asleep. I for interest. Loss of interest. People show diminished interest or pleasure to activities previously enjoyed and things they have to do that they do not enjoy. G for guilt. We see inappropriate guilt in younger patients, and also we see worthlessness in elderly patients. So E, energy. Patient would experience low energy or loss of energy nearly every single day. And they also easily fatigue or complaining of achiness. C, for concentration, lack of concentration. People appear easily distracted. They cannot remember things. So, A is for appetite. Change in appetite can cause significant weight gain or weight loss. P, for psychomotor. Well, it's more of the behavior, how they move around. S is for SI, which is suicidal. Some people think about suicidal all the time, and others actually have a plan. So, please, if you or someone you know has suicidal thought or plan, seek immediate help. You are not alone. By no means, you're not alone. So please talk to your provider about how you're feeling, and they can definitely refer you out or help you out. All right? And also, some of the symptoms can't be associated with medical condition or substance use. They cannot be associated with any type of medical condition. Well, treatment choices. In order to treat this disorder, we have to, number one, have the proper diagnosis. Proper diagnosis is really important, as well as identifying other conditions, such as other psychiatric and medical causes. So, for treatment, we use medication, SSRI, like we mentioned earlier. And also we use other type of interventions, such as psychotherapy. Therapy can give you the tools needed to fight depression and also improve quality of life. It is also beneficial to know about your depression. Having information about your specific disorder can be helpful in determining treatment. What are the symptoms you experience? How long you have been feeling this way also is very important in determining which type of depression that you have. Please stay tuned for the next video on persistent depressive disorder. If you like this video, give it a thumbs up. Share it and subscribe it. Please comment down below if you have any question or feedback. If you know someone who's going through this disorder, don't forget to refer them to my video. Thank you for watching. As always, I'll see you in the next video.